Let's get started. Welcome to Digital Democracy on Tap. I'm Sarah Jane Crespo. It's been 2 months since our first COVID-19 conversation. We've covered how it affects your pocketbook, your children's education, your dinner plate, and more. It's time to return to the health effects of COVID-19, as there have been so many developments and discoveries in this time, but there are still many unknowns. Send us your questions or your comments, and we'll get to as many of them as we can during this hour. On our panel this evening is Michael Lowe, Wesley Hospital's ICU nurse manager, Dr. Rebecca Reddy, founder and managing partner at Redbud Pediatrics, and Dr. Chloe Steinshouer of Pulmonary and Sleep Consultants of Kansas and director of ICU and Critical Care Services at Wesley. Welcome, everyone. I'd like to start out with just a general question each of you can answer. What are people not understanding about how the virus spreads? What is it that they should know that you don't think is commonly understood by people? Dr. Chloe, do you want to start out with that?
Yeah, I think we were just chatting.
Yep.
I think that what people expect about this, that it's primarily a respiratory virus. We've all heard a lot about this, and that's where the masking and the hand washing and not touching your face comes into play. But what we also know is that this disease is also shed from the gut, which means that it can be in fecal transmission. So like a lot of diseases that we see spread, people who maybe aren't washing their hands very well and then touching surfaces, and then we touch surfaces and touch ourselves like our face, and you spread it that way. And so we see that a lot. Actually, they're starting to see that in healthcare, where that's how transmission is happening to some healthcare workers.
Okay. Michael, what would you say a lot of people need to kind of understand about, or do you think is not commonly understood about what we're facing and how it spreads?
Well, the point that Dr. Steinshouer made is one that I think most, if not a lot of people aren't aware of. A lot of attention's been made on the respiratory aerosolized droplet. There's a lot of research still yet to be done about exactly how and how frequently and where the people are most at risk to contract it through those methods. But I'd say sticking to the guidelines of masking in public, yeah, I mean, if you're out in the public, not in the healthcare industry, as a nurse, physician, anyone working in the healthcare industry around patients, following those safety guidelines would be the best, because that's most likely where you're going to encounter it out in the public, especially now that businesses have started to slowly reopen and in public areas.
Yeah, that's a big issue, the reopening and how that is going to affect all of this. We'll get into that more in a few minutes. Dr. Reddy, why don't you weigh in on this issue as well?
One thing that I think is not talked about very much is that dose exposure is important too. And dose exposure means if I am an ICU nurse and a patient gets upset and frustrated and smacks off my protective equipment and then coughs directly into my face and my eyes, and that's called a very high dose exposure. You probably were showered with, hundreds or thousands of viral particles. But if I'm out at Dylan's and I'm wearing a mask and my child is wearing a mask and somebody walks by us who is in their not yet symptomatic but has COVID phase and coughs near us, even though I'm exposed, my dose exposure is very low. And you can still get COVID if you have low dose exposure, but you're less likely to get it big and hard and fast. So even though masks aren't 100% effective, it is a way that you can reduce your dose exposure as a wearer.
So is this maybe part of why some people who get it have a mild case and others who get it have, an extreme case? Is this part of that? I know it's maybe several factors.
That's probably part of the discussion, but more important is like just that individual's own risk factors and their immune system's capacity to respond to the infection and their age. There's so many factors that, it's hard for us to explain what percentage of each factor comes into play.
Now this question also for all of you, it may be too big, but what do we still not know? Like, what are the biggest things about COVID-19 that we still don't know and that maybe is being researched right now? Dr. Steinshouer.
Oh my, I get to start again.
Kick us off.
There's a lot we don't know. You have to remember this really came to light at the end of November or beginning of December of last year, and then really has been present and studied in the US for about 4 months. And so the amount of data and the amount of information that's coming out about COVID and how it is spread and how it affects the system and what we can use to treat it is astronomical amounts of information. Every day there's new information coming out for us to try and learn from and to assimilate, and things that we had considered maybe would work before. So this would reference something like hydroxychloroquine as a treatment. And then as of yesterday, a very large study has suspended the hydroxychloroquine arm because of harm and lack of response for patients in the hospital. So what we're finding is what normally takes years of training and learning and bench research and then clinical research, we're doing in days at this point. So I don't think we fully understand the mechanism of how it makes people sick. We're starting to learn those things. We certainly don't know what the best treatments are for people who get ill. We, like Dr. Reddy was mentioning, we don't necessarily understand why certain people get so sick and why certain people are asymptomatic, or why some people are super spreaders and why some people don't appear to shed the disease as much and spread it.
I didn't realize that was that is a thing, that some people are super spreaders. That's interesting. That would be good to know. Michael, what do you think if you could have a magic genie give you a wish to have the answer to some question about COVID-19? What would you like the answer to?
I think a lot of people probably have the same question, but I know some research is being done regarding to have had COVID and weeks, months down recovered, with some research showing a follow-up test will still show up as positive. You know, what with no symptoms, and then those viruses are tried to be grown in the media and they're not growing, so it appears to be not a live virus anymore. But what, if any, lingering effects that may pose to that individual, as well as any like the body's immune response in months and potentially years later, like will they have sustained immunity, and what is their risk, not only for themselves again contracting it, or prolonged like exposure to other community members, families, loved ones, as well as some of these cases about children that you're seeing these later effects with the multi-organ inflammatory syndrome, I believe. A lot of reactions that nobody anticipated, no one really knows what to make of, that are showing up later down the line, that are yet to be seen, and just some lingering questions. And like Dr. Steinshouer said, just lots of research yet to be done and a lot of unknowns surrounding this virus.
Yeah. Dr. Reddy, what do you think?
You know, one of the things that we don't know yet, and we're not talking about very much, is how to best get our children safely back in school. And that's something that I'm just going to shout out to all our educators and teachers, administrators alike out there for all the hard work that they've done to try to figure out how to work digitally, what to do for the summer to keep kids fed and help them do some remediation. And I'm concerned about just formulating a plan for how to get our kids safely back in school, because most of them should not be at home long term. Kids are missing out on a lot more than education by just staying at home. So I just want to stimulate community discussion about how can we best safely return our kids to school, especially the age 5 through 10 to 12 elementary school age kids who absolutely need to go back.
Okay. Michael, we haven't seen an extreme number of cases in Sedgwick County, unless I'm very much mistaken, but give us an updated sense of the COVID cases in Wichita that you're seeing. Wichita, what we're seeing in Sedgwick County and Kansas. What are we going through right now as a community? Is it just what we think, it's not very much, or is it kind of more than we realize?
Well, I'm not really sure what everyone thinks about what's going on in hospitals or in nursing homes or whatever. But as far as our experience, I can say that what we've seen in the hospital community is pretty well reflected by, if you go on the KDHE website, by the spike in cases, and now they're on the downward trend. And that's what we've seen in the hospital as well. And I anticipate, I don't know if you asked this question about what I anticipate going forward, but that I anticipate kind of just a lingering continuation of cases popping up here and there. I'm very hopeful that with the reopening of the slow reintroduction of our businesses across the city and state, that the safety practices that are being recommended, both at the state and federal level, will be observed, and that we'll continue being safe around one another so that we don't see another spike for those who have made it through unscathed.
Okay. Dr. Steinshouer, do you have a sense of what the rest of the state is going through?
Yeah, the numbers from Sedgwick County are sort of middle of the road when you look at the highly infected counties. The largest spikes that we've seen are in meat packing plants in those kind of counties, also counties that had surges in testing because of that. So if you look at Ford or Seward or Finney counties where meat packing was at, Lyon as well. And then Wyandotte County had several nursing homes that were affected, and so they had large numbers from there. Leavenworth County had Lansing Prison, which resulted in a very large spike all at once. Sedgwick County is sitting in the high 500s, I believe, for total number of cases as of today. What we've seen was smaller spikes well within the capabilities of the local hospital systems. Most of them were coming from clusters, either from religious institutions or nursing facilities, or I know we had a work release program from the prison that resulted in a small spike here. We're starting to see more community spread cases related to gatherings that occurred for events. So right now we're starting to see Mother's Day gatherings resulting in some increases in cases.
A week or two, then you'll see the spike from Memorial Day.
So about 2 to 3 weeks is what the expectation is for Memorial Day.
I have our first question from Facebook. Jimmy asks, how is this event different from a typical flu season in terms of the pressures put on hospitals?
Dr. Steinshauer.
Come on. This is not the flu. And I think it's really important that we separate this out. So we know that it is a much more intensive illness for people who are critically ill. We know that the infectivity is higher, so it's much easier to catch than the flu. It is novel, which means we do not have immunity to it, and we don't have a vaccine for it. So we don't have innate protection to not catch it if we're exposed. When it comes to resources in the hospital, these patients require a lot of care, and Michael can attest to this. Our nurses are being asked to do a lot. These patients, when they are critically ill, are very, very sick. They have multiple organ systems that don't work. They are requiring longer ICU stays and more time on the ventilator if they get sick enough for that. And we know the mortality is higher. More people are dying from this. And so in the last several months, we've had more deaths from COVID in the United States than we've had from flu and flu-like illness in the last year.
Wow. So you're talking about multiple organ systems. This doesn't just I imagine that other systems might be affected at the, if a patient is really doing poorly at the end of their life in fighting the disease, but are other organ systems other than, the lungs affected early on? And what are they?
So in the adult world, we know that there are issues with lung disease. So you can have viral pneumonia, you can have ARDS, which is acute respiratory distress syndrome, which is basically the lungs start seeping fluid, become very heavy, and they don't work the way they're supposed to. And these are the people that require a ventilator and they require a lot of support. These people often develop shock, which means they can't maintain their blood pressure to circulate blood and oxygen around to the organs that need it. We know that there is a cardiomyopathy or a heart effect early in these cases. These patients are coming in with heart failure, which means the pump of their heart is not as strong as it should be. We're seeing a lot of heart rhythm issues in these patients. And then we're seeing what they call cytokine storm. So it's the initial phase of the illness where the body's trying to respond, and it results in very high uncontrollable fevers and the complications that come from that. We see wide irregularities in blood sugars and blood pressures and neurologic status and how their brain is working with that. So essentially what the system does is tries to fight this virus and goes into overdrive, and that results in a multitude of downstream effects where organs aren't getting what they need.
What you're saying about it affecting the heart is very interesting, and it makes it what is said about how it affects children, it kind of makes a little connection there. Dr. Reddy, do you want to talk about what we see and how it affects children? Have we had any cases in Kansas or in Sedgwick County?
So in terms of cases in Sedgwick County for children, first I have to say that, our demographic data for the state is not very transparent. So I can't tell you that I know how many kids in Kansas have it, because the state's not been capable of sharing that information yet. But, we've tested in my practice 50 children thus far, quite a few of whom I think had it and did not test positive. We only have 2 positives, and both of those children are African American. So I just like to use that too as a segue to talk about how Kansas is #1 in the nation for disparities in death from COVID. 30% of the deaths in Kansas are African Americans. And our population in Kansas is 5.5% African American. 30% of our deaths are African American. Wow. So there's a huge disparity there.
Right.
And then, talking about the mortality of COVID, just in terms of general population, not kids specifically, but in general, flu will kill about 2 in 1,000 people when they get it. COVID will kill 2 in 100. So this is more deadly by a magnitude of 10. If you are a healthy 5, 6, 8, 10, 12, maybe 15, 20-year-old, you're probably going to be fine with COVID. And we're not sure why exactly, but most children aren't even that symptomatic. They carry this and they get over it, and they spread it to others. So most kids do fabulous. The multi-inflammatory, multi-system syndrome that has lots of different names in children is exceedingly rare. I mean, it's real and scary, and it can absolutely infect the heart. There's several children who have died of it, but it's extremely rare in children. Most children do not become that sick from COVID-19.
Are the children the super spreaders? Are they among the super spreaders?
Young children, probably not, because they're not big enough to cough and expel the quantity of virus that an adult would be, but older kids, maybe. I don't think that we have that knowledge yet.
Interesting. Michael, how are nurses at Wesley dealing with the flow of COVID patients? Is it pretty manageable at the moment? Or, how much does it tax the regular day for you all?
Well, like I mentioned earlier, now that the cases that we're seeing have gone down, and also now that we've been dealing with it for a handful of months, we've gotten used to the type of care these patients require. And it does, like Dr. Steinshouer said, not all of them that we've seen have been incredibly sick and requiring support for multiple organ failure. But even the most, the healthiest ones that we've seen in the hospital require several additional steps for the protection of the staff as well. And that protection of the staff extends to the protection of their families and the rest of the community. Going back to the question of what's the difference between this and the flu? I mean, we've seen the flu before. Yes, it's a little bit different each year, but we typically know how it's going to be transmitted, the severity that we're going to see in the patients, the types of patients we're going to be seeing, and what the care looks like. With this one, no one really had any idea other than those early studies about how it's transmitted from one person to another, how frequently, some more than others, and what makes up that difference. How do we avoid it and mitigate it? All that leads to just taking the absolute highest degree of precautions with every patient every time. So gowns, gloves, face and eye protection, N95 respirators. And yes, you put all that in before you go in the room, but anytime in the room, once you touch something, that means those gloves come off, you wash your hands, new pair of gloves. It's just step after step after step to make sure that you're keeping both that patient, yourself, everyone around you, and people out in the community safe. So I think that's something that a lot of people who don't work around infection prevention strategies all the time don't really realize, is all these extra steps that are required to make sure we're keeping our community safe, and our employees who need to stay healthy, come back to work and take care of these patients.
Michael, what advice would you give to people who maybe have an occasional cough, or they're, you cough nowadays and it's like, oh my gosh, is it COVID? First of all, what would you tell people? But then also, can we decrease how hard hit we are if we have COVID-19 by taking some kind of action at that first sign of it?
Are you asking if you know that, if we, like, say, if I have a cough and I know that it's COVID-19, what can I do to?
Yeah,
or
to
if,
make
if
it
I just have
a more mild case. Are there, you have a mild cough, you're afraid it might be COVID. Is there anything you can do to?
Well, so I hear two different questions. One, if I have a cough and I don't know what it is, wear a mask to protect everyone around you. And if it's just a cough, I can speak from experience because I got a little bug right at the beginning of this COVID craziness. That was just a mild cough. Went to my doctor, didn't think it was concerning for COVID, took some antibiotics and cleared up. I wore a mask. We were all wearing masks, but I would have wear a mask just to protect anyone around me. I stayed home for several days till it cleared up. If that's you, if you're in that case, wear a mask. If all it is a cough, monitor your symptoms. We know what the classic symptoms are that have shown up most frequently for COVID. Fever is a big red flag, cough, shortness of breath. And they're changing all the time as new evidence emerges single day. But it's such a lot to keep track of for anyone who doesn't read every study that's published every day. Just talk to your doctor if you're concerned. Give him a call. Luckily, the testing availability has increased dramatically. Like, most tests can be done. Like, you don't have to go be an inpatient in the hospital to get a test anymore. If your primary care provider can't provide you with a test, if they've run out or whatever the case might be, I know a lot of immediate care clinics can. They're pretty accessible. But it's not to say that if you have a cough, you need to run out and get a test. But just monitor your symptoms, talk to your healthcare professional, talk to your primary care doctor. If you don't have one, go to an immediate care clinic. But cover your cough with a mask.
Hey, Michael, can I just add to that? I love so there's a new study that was published in Science last week that shows if you're wearing a surgical mask, like the cotton surgical masks that are thrown away, that it will catch, if you have COVID and you're in your pre-symptomatic, like Dr. Steinshouer wore, If you have COVID and you're in your pre-symptomatic phase or early phase, and you cover your cough, that it will catch 99% of the viral respiratory particles. And it's not quite as good in a cotton mask, but it's still really darn good. So you're wearing a mask mostly, like I wear a mask whenever I go out in public because I'm a healthcare provider. And I don't want to be one of those people who is pre-symptomatic and sheds it. So I think healthcare providers probably already know that and are conscientious, but like the public needs to know that those people that are wearing masks, they're not paranoid. They're probably healthcare providers, or they're people who have risk factors. And so, you know, when you see someone wearing a mask, it just means that they're being cautious, maybe for good reason. It's not people that are anxious or paranoid. It's people that are trying to decrease them sharing their germs with you. So
yeah, they're protecting you.
Thank you for wearing that mask. Don't look at them like they're a pariah. They're trying to be cautious to protect you.
Yeah.
It's about being part of a community and showing empathy for those around us by wearing a mask. The idea is that it may not protect me perfectly, but I can certainly do my best to not share with anyone else.
Yeah, I'm amazed by that statistic. 99% is pretty darn good. That's amazing.
For the infected person, not for the person. Yeah. It's really good, really powerful thing that you can do.
The other thing I'm going to chip in here off of what Michael said was tests are a great deal more available. And in Sedgwick County, we have a resource, which is the health department. And if you dial 211, they can help you to schedule testing through the health department. The symptoms have changed greatly. It used to be you had to have a measured fever at the time of testing for them to test you, or you had to have a known positive contact. Those are now wider. They're offering testing to a lot more people, and there are a lot of options on there. If you're unexplained fatigue and malaise, or if you have the cough or shortness of breath or fever, and then some GI symptoms like diarrhea, loose stools, nausea that's unexplained, then the health department will help with getting you testing as well.
I have several questions coming in here from Facebook. Rex on Facebook asks, do you have a sense that people who should visit clinics for other reasons are staying away? As though that the COVID phobia keeping people who really should go to the hospital away from going? Is that happening here? You've heard of it happening nationally, but do you see that here?
Well, I mean, I'll take that one. I will say that in our pediatric office and nationwide, there's a group of us that manage practices that meet on a weekly basis. And in the middle of March, when this all came out and there were shutdowns across the nation, visit volume plummeted. And especially in the Northeast and in Southern California, their visit volume plummeted like 80%. And they were only seeing like the sickest that absolutely had to be sick and had to be seen. But you know, over the course of the last 3 months, as this has gone on, I think a lot of families have discovered that their primary care doctor does telemedicine by video. A lot of us have gotten our processes cleaned up enough that we feel that, you know, our offices are safe. And I feel like my office is absolutely safe for my patients. I have babies and kids that are coming in for their well checkups now. This is probably the cleanest, you know, viral free that children in our community have been in a long time, because they've been home making their parents crazy for the last 3 months almost. It's been 10 weeks. And all these kids, like their tonsils aren't big anymore. They don't have little lymph nodes. They don't have a runny nose. And, you know, we're keeping separate spaces in our office, like one space for sick, one space for well. Lots of offices are having you call in when you arrive to their clinic, like mine is. You don't wait in the waiting room. You're escorted directly to a patient room. There's extra cleaning protocols that we have in place. Everyone is masked. We want our patients to wear masks too. So if patients are afraid to go back, like I will speak for my own clinic. I'm not afraid for my own children to be in my clinic, and they have, in fact, to get their checkups. And if your practice is being conscientious, you should call your family doctor or your primary care doc and see, do you have testing at your office? And if you don't, like, you need to speak to the nurse or the doctor to find out if you should get tested and where they recommend for you to go. Go through your medical home, your primary medical doctor, to find out where you should get tested and if it's safe for you in their office.
For anyone who's just joined us, I'm Sarah Jane Crespo, and this is Digital Democracy on Tap. We have Michael Lowe, Wesley Hospital's ICU nurse manager, Dr. Rebecca Reddy, founder and managing partner at Redbud Pediatrics, and Dr. Chloe Steinshouer of Pulmonary and Sleep Consultants of Kansas and director of ICU and Critical Care Services at Wesley on our panel tonight. Please join our conversation. We'll try to get to everyone's questions before 6 o'clock. Can each of you share some of what your experience as a frontline worker has been? Are you concerned about your own health and safety during this time? What have you all kind of been going through over the last couple of months?
I guess I'll start with that one. Yeah, the ICU nurse manager, all of my direct reports are nurses, not all of whom have been right at the front lines, depending on where patients are located throughout the hospital, but they're the first line at the patient bedside through this COVID upswing and now back on the downward trend. And it was very stressful and very scary at first, and it still is to some degree. Like we've managed our way through it, and it's still around, and there's still a lot of unknowns that we've talked about, but it just led to a lot of health, emotional, personal, family, community-related stress and anxiety of the unknown. Even because I can say we're very fortunate, at least in Sedgwick County, with our ICU bed capacity and with our availability of the personal protective equipment, or PPE, to keep all of our staff protected throughout all the shifts. But even with that in place, all the unknowns out of the gate, when we were starting to see patients coming in, we only knew what we've heard from other communities and the research that had been published so far. It was still really scary. It continues to be, but that perspective from the frontline nursing is, I think, there's an understanding of that in the community, and I will say the community outreach, at least that we saw at Wesley, we've got lots of donations from restaurants and other people wanting to help in any way while they're stuck at home and unable to go about their normal lives, was overwhelming and very powerful, and very all the staff was incredibly grateful to have that support and feel that, to help through the stress and uncertainty that I mentioned. But it was very real. It's still very real. It's better now that we've gone through it. But yeah.
Go ahead, Dr. Steinshauer.
Well,
I see you ready to talk.
I'm thinking here. I think we all feel that. We all feel, we like to solve problems in healthcare. And so the uncertainty is hard for us. And I will say, from a critical care side, we've been seeing not just the COVID patients, which are patients that maybe we're not all sure what to expect, right? What we've been learning and what we see in these patients evolves, and we've seen different outcomes, but also the patients who are coming in for healthcare. You mentioned about delaying care and not necessarily coming in and getting routine care. Well, that actually has made changes in the community with regards to our ICU utilization. Even when the hospital numbers were down because people were staying home and elective surgeries were postponed, the patients that we did have were sicker. We have severity of illness scores that we monitor for that, and we could see that our patients were coming in later than they should, probably, or that they would before all of this. And so we were seeing complications that we haven't seen in years. People with a rupture of the heart muscle wall because they waited on a heart attack for a very long time, or people who had a dissection, meaning a split along their aorta, and they waited to come in before they could have it repaired, where normally that pain would prompt somebody to come to the ER right away. And so that makes the life of our ICU nurses and my team and all the hospital physicians difficult, in the sense that you spend a lot of time and energy with very sick people. And so then you have to think about coming home, and I get home and we have a set plan for where I strip off and put my kit, and it goes into special stuff so that we can wash it separately, and my kids can't come near me until I've cleaned up. They understand when they see scrubs that they can't come be with me. And so there's a lot of protective things that go on in people's homes, and it's changed our routines, and it changes how we deal with our families. I see my family a great deal less. I have extended family in town that we had family dinner every week, and now that's hard. So everybody's lives are changing from that. I am extra paranoid about passing this along to either my children or to my parents. And so I see my parents on their porch and I wear a mask. I wear two, actually. I wear a surgical mask, and then I wear my super sweet KU mask right over the top of it. So it changes how we live our day-to-day life. I come to work and I go home. That's about the extent of where I spend my time.
Dr. Reddy, anything you'd like to add?
I think I'll just add on top of what they said, really. I will say that I had some concern for my family, of course, and my patients. Unique concern about my patients is that I don't want them to be so scared to come in that they won't come in to get their routine immunizations. Because, the Midwest, we were protected. We did not get hit with COVID until almost a month, really, after it happened on the coast. And what they've seen in New York, where I have family living, is that measles vaccination has fallen by 50% in some areas, because people are afraid to bring their babies into their doctor's office to get their shots. And when you thought that COVID was bad, measles is crazy bad. Measles is ugly. You infect maybe, every person who has COVID can infect maybe 2 or 3 people. If you have measles, you can infect typically 18 to 20 people. And it's deadly in children, and it causes brain damage. So I have worries about a resurgence of all of these horrible vaccine preventable illnesses, because people are afraid to take their children to the doctor to get their routine shots.
Wow.
That's a unique paranoia that I have.
I'm going to worry about it now, too. So
yeah, so I want everybody to feel safe, going to the doctor to get your kids' routine immunizations. We don't want COVID to pass and then a measles or a Haemophilus influenza meningitis epidemic to hit our community.
Well, you mentioned your office is doing all of these protocols. You're not alone in that. Our outpatient office is doing all the same things. We screen all of our patients. We have done as much telemedicine as we can to protect our vulnerable. My outpatient population is primarily people with lung disease. And so we are working very diligently, because our patients are high risk. And so we want to make sure they are safe, but they need to have their routine care, because the way we keep them well is we stay on top of the disease. And so in Dr. Reddy's practice, that's staying on top of well child and immunizations and preventive care. And in ours, that's staying on top of medications and surveillance. I know lots of primary care clinics around town that are being very cautious and making sure that they're providing the best care, and they're keeping offices just immaculately clean as you can, and with staff masked and supportive, and really going out of their way to make sure that we can get people in safely, provide the care that we need to keep the community and our patients healthy, and work our way through this, because this isn't something that's just going to taper off and go away in the next weeks and months. This is something that we're going to be dealing with for a while.
I have several more questions from Facebook that I'd like you guys to get to. Cindy says, I'm hearing that tests are A, slow, and B, unreliable. The results take days, maybe a week, and come back as negative even when the person clearly has many of the symptoms and is quite ill. What's up with that?
So,
yeah, go ahead.
I'll start. Every test that we do has a sensitivity and a specificity. That means we know within a range how many of patients that truly have the disease are going to test positive, and how many who have it will test negative. What we are finding out is that certain forms of this test, there are rapid forms and ones that take a little longer. These are looking for PCRs of the viral genome.
What's a PCR?
Polymerase chain reaction. It's a way that you amplify it. So they basically make copies of copies of copies so that they can get enough to look for.
Okay.
And with those, we have some of the rapid tests are a little less sensitive, which means they're less accurate, but we can get a turnaround in 15 minutes or 30 minutes, right? So somebody comes in and I need to know right now, we get that. If I'm still highly suspicious, we send it for one of the slower, but maybe more accurate tests. The initial reason that the turnaround was so slow is because the labs were overwhelmed. There weren't enough. There weren't enough places that were doing the test, and they were getting huge batches of tests all at the same time. When we send tests away now, my average turnaround time, if we send it out to the state, is about 48 hours. It's about 72 for some of the private labs because it has to travel to places like Kansas City. But in the hospitals, both facilities that are taking care of these patients have rapid turnaround generally within a day.
So we in Sedgwick County in Kansas are using both kinds of tests. So the rapid
Correct.
kind that's less sensitive and the more sensitive that takes longer. And then the healthcare professionals kind of make the call of which type to use. What if you drive up to a testing facility? You know, you can just drive up now and get those tests. Which one is it that they're using? There was a Wichita State location, I think, not too long ago. Maybe it's still open.
Health
Are you
Corps?
familiar?
Is that the Health
Oh,
Corps?
Health Corps. I'm sorry. That was what I was thinking of. Yes.
So
do you know which kind? Yeah, go ahead.
They're all the same type of test. They just have a different process for testing it. And so the sensitivity is a little different between them. They are using one that is on the higher end of the sensitivity spectrum, which means it has a little bit longer turnaround because it's not done here in town. The reason for the turnaround issue is because it has to go somewhere else.
So Jessica on Facebook asks, what type of masks are recommended? Many people have 1-layer cloth or 2-layer cloth masks, which is preferred. Of course, you have your cloth and then your was it a Jayhawk mask?
Oh yeah.
Which college was it? Oh no.
I have one too.
There you go. Okay.
I have them always.
Excellent. So what do you recommend? Anyone who recommends a mask?
Well, for those who weren't tuned in earlier, Dr. Reddy study that found that surgical masks, like the lighter blue one that Dr. Steinshouer just modeled for us, level 1 surgical mask like that has been found to 99.9% of the viral particles for the wearer. So if you have COVID, or maybe you don't have COVID, or you're not sure, but
you keep your germs
if you're wearing that in public and you have a sneeze or you swallow some spit and you cough, it might be that you could have COVID and you're asymptomatic, but still potentially transmitting that disease to others if you weren't wearing a mask. So there's two functions of the mask type of that and the cloth mask, and frankly, for public use when out and about in the community, for necessary shopping and whatever else the case might be, the wearers protect others from the germs that they may or may not be carrying. And it really only works, it works best when everyone involved is wearing a mask. Your mask protects those around you, their mask protect you.
What about people who have a hard time breathing, someone with asthma or someone with some sort of lung problems? What should they wear? Because wearing a mask for them can make it even harder just for them to breathe normally. Is there a different kind or some other kind of thing that you recommend for people like that?
The CDC in their public masking guidance, and I believe it's still the same to this day, you don't if the surgical mask is too tight and you have a problem breathing, some sort of mouth and nose covering, like even a bandana, it's not ideal, but that will provide some barrier of protection to those around you for sneezes, coughs, or even just heavy breathing. Even heavy breathing can push viral particles out into the air in the immediate space around you. I'm obviously ideally a cloth mask or a level 1 surgical mask are more ideal for the protection of the community, but really anything is better than nothing.
Okay.
I will chip in here to say, as a lung specialist, that there's very few lung conditions that make it so that someone can't wear some sort of mask covering. The masks that we're asking people to wear are not tightly fitted to the face. And so when you pull air in, when you breathe in, air is coming in from both around the mask and through the mask. It's when we're breathing out, the goal is to minimize the exposure out. So
that's why you had that little eyebrow up a minute ago.
Yeah,
I saw
almost everybody can wear a mask. In fact, I ask all of my patients to wear a mask in clinic to protect my staff.
Okay.
Right? I don't want my staff to catch it from a patient. I don't want my patients to catch it from my staff. So everybody in our clinic wears a mask. And most of our patients are coming in with their own. And if they don't have one, we provide them with one of our surgical masks.
Sarah, I don't want parents in my practice or parents of young children to think that they need to put a mask on their children that are less than 3 years old. It doesn't work. It makes them touch their face all the time, and it potentially is like a choking or strangulation hazard, just depending on how they've affixed it. So, and then I'm having lots of parents who have young children who come into my practice who cannot wear a mask because their young child cannot stop grabbing it off of their face. You really have to adjust to your young child's needs, or if you have a child with developmental disabilities who doesn't tolerate a mask, don't put one on them, because then they're just touching their face all the time and touching everything when they go out and then touching their face to take off their mask.
That's great advice.
But when you wear a mask, you're protecting that mom with a 6-month-old baby who for some reason had to run into the grocery store because she can't safely mask her child.
What do you all think is the best way that Wichita and Sedgwick County can support their frontline workers? There have been, the headlines of free coffee and lunches. And Michael, I think you mentioned something along those lines. What is most helpful for you all? Do you appreciate, I'm sure you appreciate that sort of thing, but would you rather just have folks stay away or stay home? How can we all help you?
Dr. Reddy?
Oh, I was going to call on Michael. You're in the thick of it every day, Michael. A sister that works with him who's in the thick of it every day too.
Well, I'll say again, like I said before, the support that's already been provided through those lunches, and people out with signs in the community, standing outside of Wesley, and I'm sure at the other, at the Via Christi locations and other clinics, just showing their support. That's really meant a lot to not just nurses, but everyone who comes into work every day at the hospital, from our housekeepers to administration even. It's meant a lot, because it has been a lot of healthcare is always hard work, but it's the stress level on top of it's been tough, and that's meant a lot. But I hate to keep going back to this, but by taking care of your own health and wearing a mask to protect those around you when you're out in the community, we keep talking about masks, but it's really the best way right now. Well, that and washing your hands. If you've been lucky enough to get some hand sanitizer, and I think you can find it a lot easier now. Mm-hmm. Keep a travel thing on the go. Anytime you're unsure, wash your hands. Anytime you know that your hands are dirty, wash them. Especially wear a mask in the community, and and the advice coming out from the KDHE, from the CDC, from your care physicians, it's all based in the best and most current evidence. Yes, it is true that there still are a lot of unknowns, and when we find out what the new best evidence is, that'll come out as well. But I would just encourage everyone to continue to trust in all the people who are committing their hours, days, and lives to the research of this disease and others. And the advice that they're putting out there on these trusted websites and other forums is important to listen to and follow.
Any other thoughts on how we all can help you or support you all? Okay. Dr. Reddy, do you have any advice for women who are pregnant during this time and for parents who think they or their child might have been exposed to COVID-19? That's two whole different questions, but.
Sure. Like the advice I have to women who are pregnant at this time is to trust your OBGYN. I've had a couple of pregnant women who've called my office with requests for advice and information, and I defer to your OBGYN provider. Please call them, make sure that you are following their guidelines, make sure you're masking and just practicing social distancing, and call your OB provider. And for parents of young children, I'm actually telling them now that we're kind of opening up ourselves to some socialization, that they should choose those people carefully, especially if you have a child in your family that's ill or potentially has special needs. That's a child at risk, and it's not that I don't want you to stay sequestered away long term, but maybe you should perhaps open up first to the cousins, because those are family members that your children can play with and start socializing again, but also it's a family that you can trust to share information with you and to stay safe. And this is probably the cleanest your kids have been for a long time. So if you want to visit grandparents, that you can consider doing that now if you're doing it safely, and not to keep your children hidden away to the point that it really damages their socialization. You have to have some sort of context that you accept into your life. This is going to be a long haul for potentially a couple of years, not for a short 4 to 6 month period. So you have to start being smart and ration your social interactions with people that you know and trust and are good for your family.
Dr. Steinshouer, what are some of the health impacts that you're seeing after someone recovers from COVID-19? Of course, it can take weeks or a month or a long time to be well again, but are there effects that last longer?
So the information on that is still developing, because the first cases of this that we have been able to track long-term were December. So I have 6 months as considered long-term, which in the medical world is not really long-term. We know that people who develop respiratory failure and need the ventilator and develop acute ARDS or severe viral pneumonia, they can have long-term lung damage, meaning that they can have scarring that's visible on imaging of their lungs, and they can have loss of lung function. If you're ill enough to be in the ICU, you can have loss of muscle mass and strength and function. We know if you're sick enough to require the ventilator and sedation and support for your blood pressure, that you can have long-term effects with regards to thought processes. And we know that patients in the ICU can develop anxiety and post-traumatic stress-like syndromes related to being critically ill. There are cases of people developing blood clots during the course of the acute illness and then after they have gotten well from being acutely ill. So people who develop a viral pneumonia but then 2 or 3 weeks later come back with a severe complication of blood clot, both in the veins, so like a DVT, which is a clot like in a leg, or pulmonary embolism, which is a clot in the lung. There have also been reports of strokes or clots in limbs, like legs, arms, where blood flow is not getting through into artery. So we're seeing more and more information come out related to this. This is going to be a constantly moving target for us, trying to pin down what's related to the virus itself, what's related to the complications from it, what's related to the treatments and the management. What we know, though, is if you are somebody who has had COVID, you can expect to feel tired. We have seen people have persistent coughs that can last up to weeks. Shortness of breath can last for a long time. People who are symptomatic can have fever-like syndromes for several days to weeks that come in spells or waves. So you have people who are very minimally symptomatic, and then you have people who are really suffering for a long time with the disease.
Wow. Is there any information yet on how to or I guess what kind of therapy or I don't know, exercises or what people can do, after the fact to improve more quickly?
Like any illness, the key is activity. The stronger you are when you go in, if you get sick, the better you will do with illness and the better you will come out. So people who are physically active and doing what they can with regards to their nutrition and taking care of their health as much as possible, keeping their chronic medical conditions under as good of control as possible, which means, again, coming back to this, following up with your physician, doing your wellness checks, staying up to date on vaccinations, those people are going to do better in the long run. They tend to survive the illness better. And then afterwards, often it depends on what sort of limitations there are. We use therapies like physical therapy, occupational therapy, and honestly getting people back to being active and living in the real world again.
Now, Michael and Dr. Reddy, both of you kind of alluded to the future and making a prediction in some form or another about what this is going to look like, how long it's going to take. I'd be curious for all three of you to kind of make a bet. That's not right at all, but to talk about what you think is coming in the next, let's say, the next several months here, and then what the whole scope of this thing is going to be. When might we resolve and people always say get back to normal. I'm not sure that we ever will, but when do we get back to socializing on some level similar to how it used to be?
That's a dangerous question.
I know. Yeah. You don't want to be wrong, of course, but
I'll let you start, Dr. Reddy.
Yeah. So I guess I'm banking on it, and I'm not trying to set my expectations really high and then have everyone be disappointed when it's not gone. And so I'm expecting that it's going to be around for about 2 years. And my concern is that every winter, my practice is super, super busy in the months of January and February with all the multitude of really bad respiratory viral illnesses that kids get and that they spread, including the influenza, different subtypes, the croup virus, the enterovirus that causes hand, foot, and mouth disease, and the RSV virus and other related viruses like that put babies in the hospital. And I think that combining one of those viruses with COVID-19 is a recipe for disaster. And I just have to shout out to Notre Dame institution that I think was the very first in the country to come out and say that they're closing down their schools between Thanksgiving break and the second or third week of January. Because that's when viruses get incubated, when everybody goes home for Christmas and sees their extended family members and everyone gathers together in large groups for holiday celebrations and parties. Plus we're all cooped up anyway because the weather is bad. So I'm worried about that time period, and I'd like to reduce our infectivity of one another by potentially even having a long winter break in our school year this year for everyone, so that we can keep our germs to ourselves and come back healthy in January and potentially avoid a COVID spike.
Michael?
Well, I'm going to stay away from making any sort of timeline predictions. Rather, I will predict that Sedgwick County and Kansas will continue to do as I think they've done a good job so far. Kansas was one of the earliest states to implement social distancing orders statewide, and I think that had a profound effect on what was the limited number of cases we saw both Sedgwick County and statewide that could have been a lot worse. And those measures continue even with the slow reopening of economies. And, I'm hopeful that partly from conversations like this and others that are being had throughout the community in the state is that people will listen and keep the precautions in place. And continue being as healthy as possible so that we'll continue seeing a downward trend. I don't anticipate, like Dr. Reddy said, that we'll be rid of COVID for quite some time. And we see some promising early research being done on vaccine development that will still require lots of clinical trials before we know the efficacy and how reliable those will be, as well as, like Dr. Reddy said, what the combination of COVID plus all these other diseases that rear their heads in the winter months. I'm not looking forward to what the worst outcome of those could be, but I'm optimistic that with the right measures in place, even though they're not ideal, they're not the way that any one of us want to live our lives. They're the most important to keep us continue to be safe and keep this disease at bay and make it as short as possible until it is behind us.
Now it is already 6 o'clock, so we're running out of time here. So Dr. Steinshouer, if you want to make a prediction, you can. If not, that's all right. I would also I would ask each of you to give any last tips or any last words of caution or advice or ideas for folks to take home with them tonight. And Dr. Steinshouer, we can start with you.
Well, why don't I roll in a prediction and a recommendation altogether?
All right.
I think as we start to go back to what people are going to refer to as normal, we're going to see people become a little more lax with these measures that we're asking people to continue. And this is the hand washing, the social distancing, the masking, the not touching your face, and being cautious, like Dr. Reddy mentioned, of the groups that you're interacting with, because each circle that you interact with interacts with another circle, and that's how this disease can spread. I think that we're going to start to see more cases, and that's going to be a combination of testing availability compared to what we've had, and to increase spread as people start to travel and people start to get together and have communities come back together. Sedgwick County and Kansas were very early. We started social distancing and measures far ahead of what would have been our curve. And other states with similar population densities and demographics and metro areas that are similar are starting to see their cases go up where they didn't implement these practices early. And I think if we continue to maintain some of the behaviors that we're doing, at least to a degree, we'll be able to continue the functional success of overwhelming the system and keeping our healthcare workers able to take care of these patients. A lot of the excess deaths that they were seeing in communities that were overwhelmed came at least in part from difficulty having enough supplies and equipment, and honestly, healthcare staff to make sure these patients had all of the optimal care. When you keep those numbers within a range of safe, we have a lot more opportunity to do things for these patients. And we've also bought ourselves time. We now have multiple trials running in Wichita. We have multiple drugs that are available that appear to change the course of disease in these patients and may improve survival. So the more time we buy ourselves for that, the more time we have to find those treatments that will change how people's outcomes are from this disease.
Excellent. Dr. Reddy and Michael, any last tips or advice that you would give?
Yeah, I just wanted to, one brief thing is that kids with asthma don't appear to be at high risk from COVID. So I just want to reassure all those parents of asthmatics out there that your kids appear to be like a normal kid to COVID-19. And then I just want to say that, I love Wichita because it's like a small town and people know and love one another. It's funny to me how I feel like I'm one person separated from pretty much everybody else in this town. And even if you're not at risk, that you should be cautious because you're doing it for others. Do it for your friends and your neighbors who are at risk. Do it so the vulnerable children who have special needs or socioeconomically at risk can go back to school and get what they need to have good nutrition and education, social skills and protection from abuse in their homes. And if you're not doing it for yourself because you're low risk, you should still do it for others because that's what we do in Kansas. we work together and we do it for one another.
Michael?
We touched on it briefly before. Don't be afraid of seeking medical attention when you need it. Like both Dr. Reddy and Steinshouer both said, the clinics are cleaner than they've ever been. That same applies to the hospital. Ideally, everyone's getting as much primary treatment without having to ever go to the emergency room. But if you're in that situation where you need to go to an ER, don't be afraid because you're worried that you might get COVID if you don't have it already. All the measures are in place to keep you and your family safe. We're screening at the door. All the staff have the protection they need. Don't let that be a reason to not seek medical attention.
Okay. Thank you. Thank you all so much for joining our panel today. We really appreciate your time. And to all of you who watched, I hope you've enjoyed our program. Next, we'll be discussing elections during COVID-19 on Tuesday, June 9th in partnership with the League of Women Voters. In the meantime, check out engageict.org for past videos, podcasts, and more. I'm Sarah Jane Crespo. Thanks for joining me for Digital Democracy on Tap. Good night.